How to relieving bloating and gas from diverticulitis bowel changes. Bloating and gas can be uncomfortable symptoms for those dealing with diverticulitis, often linked to changes in bowel habits and inflammation of diverticula, which are small pouches in the colon. To find relief, it is crucial to manage the underlying diverticulitis and adopt dietary and lifestyle adjustments that support digestive health. First, following medical treatment for diverticulitis is essential. During an acute flare-up, your healthcare provider may suggest a liquid or clear liquid diet. This approach helps rest the bowel and reduce inflammation. If an infection is present, antibiotics may be prescribed. Once symptoms improve, a gradual reintroduction of low-fiber foods is recommended, followed by a high-fiber diet to promote regular bowel movements and minimize gas buildup. Next, gradually increasing fiber intake can be beneficial. A high-fiber diet helps soften stools and encourages regular bowel movements, which can alleviate bloating and gas. However, it is important to increase fiber slowly to avoid worsening symptoms. Good sources of fiber include whole grains, fruits, vegetables, and legumes. Fiber supplements like psyllium or methylcellulose can also be helpful but should be introduced cautiously and under medical guidance, as they may initially cause gas. Staying hydrated is another key factor. Drinking plenty of water, about 64 ounces or 8 cups daily, is vital when increasing fiber intake. Adequate hydration helps prevent constipation and associated bloating, allowing fiber to work effectively in the digestive tract. When it comes to medications, using them carefully is important. Over-the-counter pain relievers like acetaminophen can help with discomfort. However, non-steroidal anti-inflammatory drugs, such as ibuprofen, should be avoided due to the risk of bleeding in diverticulitis. Stool softeners may be recommended to ease bowel movements. Some studies suggest that the antibiotic rifaximin, used cyclically, can reduce bloating and abdominal pain by modifying gut bacteria, but this should only be used under medical supervision. Lifestyle modifications can also play a significant role. Regular physical activity stimulates bowel function and can help reduce bloating. Additionally, avoiding foods that trigger gas for you personally, such as beans, carbonated drinks, or certain vegetables, may provide relief. It is worth noting that there is no universal restriction on nuts, seeds, or small fruit seeds as previously thought. Finally, seeking professional guidance is crucial. Since diverticulitis symptoms and bowel changes can vary widely, personalized advice from a healthcare provider or dietitian is essential. They can tailor dietary plans, recommend appropriate supplements, and monitor for complications. In summary, relieving bloating and gas from diverticulitis bowel changes involves managing inflammation medically, gradually increasing fiber with adequate hydration, using medications appropriately, adopting supportive lifestyle habits, and seeking professional medical advice for individualized care. Avoid abrupt dietary changes and unapproved treatments to ensure safety and effectiveness.